I'm seeing nods, thumbs up. Good, thank you. So great. So in terms of, I wanted to start by just discussing briefly the value of what we're talking about. So Sam in our team at the Neurological Alliance in England has been doing some really helpful work to understand the value of data, looking at people's experience of healthcare to the wider system, particularly to service improvement. And the message was really clear in that work. So one is that patient experience data should be seen as valuable, as any other data that you might have about your service. So it can be really powerful when you bring that together with, say, patient safety data or clinical outcomes data, or even things like staff wellbeing data in a service. So that can be incredibly powerful. More broadly, it's really important that it's a visible part of kind of quality improvement practice, particularly within service transformation. But of course, nationally and regionally, it's incredibly important that through initiatives like Patient Experience Survey, we're able to give as good a voice as possible to many people affected by neurological conditions, and indeed that they have a say in how that data is used. So it's really valuable work that we're doing, and it absolutely makes a big difference. So in terms of this survey, this is actually the 5th time that we've conducted this survey in England, but it's the 2nd time that we're going to be working together with the Northern Ireland, Wales and Scotland to deliver the survey. And it's the 1st time that we're going to be rolling out in Ireland. So we're really, really excited about that. As you know, it's delivered in collaboration with Neurological Alliances across the UK and Ireland. So together we represent upwards of 100 different organisations, all with an interest in improving treatment, care and support for people with neurological conditions. So it's a really powerful kind of collective piece of evidence, that I think we all have an interest in. The headline really for this iteration is that the responses will be collected from the 22nd of July to the 6th of November. There'll be 3 ways in which people can respond, which Cate and Hannah will talk about that in a bit more detail. And we're really pleased that we've already received support from a number of different healthcare professional bodies, such as the Association of British Neurologists, British Paediatric Neurology Association, Royal College of Psychiatry faculty on neuropsychiatry, the British Psychological Society, and the Association of Chartered Physios in Neurology as well. So we've got wide support from the healthcare professional community as well. This time there's going to be 3 surveys. So there's an adult survey for people affected by neurological conditions. There's a children and young people survey, which we did last time as well. So we're hoping to build on that. And what's new is that we're going to be doing a survey for informal carers, i.e. friends and family who provide informal support for people affected by neurological conditions. And the reason why we're doing that is because lots of you told us that it'd be really helpful to have an evidence base to kind of collectively try and think about how we improve support for informal carers. And we also heard the same from people affected by neurological conditions as well. So we're really pleased to be able to develop and deliver that. The last time we did the survey was at the back end of 2021. You may remember that was right when Omicron was hitting. So there were lots of restrictions on healthcare services due to COVID-19 in particular. And it was quite a busy time more broadly in terms of winter pressures and pressures on you in terms of service provision in particular. But I'm really pleased to say that together we were able to get together 8,500 respondents in what was a very tricky environment. And we did receive just shy of 900 clinic responses in particular. We're really keen we up those now that some of those infection control measures have been lifted. And we've already started to recruit clinics to help us to do that. And I'm pleased to say that the uptake has been really strong so far. And then just to give you a feel for who responded last time, 93% of those that responded to the adult survey had a neurological condition themselves. What that means is that 7% didn't. So i.e. people were responding on behalf of somebody else. The opposite was true for the children and young people survey. So 87% of those that responded to that survey were a parent or carer or guardian. of a child or young person living with a neurological condition. Nearly 6 out of 10 adult respondents reported having a condition other than their reported neurological condition. So lots of people living with multiple conditions. And more broadly, we did find that those living with multiple neurological conditions were more likely to report worse experiences of care. And then in terms of the adult survey, the most reported conditions were MS, epilepsy, and migraine. And we also found that we had a higher proportion of females rather than males respond to the survey. So about just over 2/3, of respondents to the adult survey were female, which is typical of surveys of this nature, but nonetheless not quite in line with the broader population. So we're hoping to address that this time. The other point to say is that we did find that less people from more deprived areas of the country responded to the survey. And we also found that we had a low proportion of those from BAME backgrounds responded to our survey, which we'd really like to change that this time, because we know that neurological conditions affect everybody. And so we want to be able to delve into some of those potential health inequalities more closely. And then a final note before I pass over to Rob is that we've done loads with the data since we published it back in June 2022. So it was actually the inspiration for the Back the 1 in 6 campaign, which in fact we're running again right now for the general election. So it's really been the bedrock, certainly, of our collective campaigning efforts since the data was released in June 2022. Developing the messaging around the campaign and working with you to develop case studies, for example, was incredibly important and something we'd like to do again. You've been fantastic in terms of sharing the Back the 1 in 6 message and sharing the message of the data. And again, Rob will give some examples in a moment from the Migraine Trust. And we recognise that we need to provide you with the right support in order to do that. So to provide support to promote the survey, we will have a communications and engagement pack again. Obviously, we've got this webinar today to give you a bit more detail about how plans are progressing. And then we'll also provide support when the data comes out at the other end, which I'll talk about in a moment. And the final thing just to mention is that when we did launch it in June 2022, we had a range of different outputs from that. So we had parliamentary events, which had constituency level data, as well as representation from a wide range of MPs, peers. We also had an online, House of Lords debate to look at the results. We, of course, developed the online petition as well for the Back the 1 in 6 campaign. So 19,000 people supported that. We received a good amount of media coverage. There was 4 policy reports and 1 larger technical report for those that wanted to get into the detail. And we also have done countless presentations, particularly at academic conferences, and developed a number of different academic posters as well for those conferences to share the insights from the data. And it's been really, really well received. And again, we're going to be looking at similar sorts of outputs for this one too. So I'm now going to pass over to, I think, is it Hannah, to talk about the goals of the survey in a bit more detail. Thanks.
Yes, thank you so much, Georgina, and good morning, everyone. Thank you so much for coming, and thank you so much for having Cate and I along as well. I'm an associate director at Ravine Reality, and Cate and I are part of the research team who are working with Georgina and everyone at the Neurological Alliance to kind of develop and disseminate these surveys, as well as support with some of that analysis and reporting. Just to say, this is the first year we've been involved with the survey, and it's a really exciting project to be a part of, something with a huge legacy, and we're hoping to kind of build on that momentum and make this the best year yet. So it's great to be talking to you all today, because obviously one of the really key dissemination routes we hope to be able to send the survey out through is through all of your organisations. Georgina's obviously recapped a lot on the survey, so I'll quickly touch on this slide, which basically outlines what we see as the main research objectives. ultimately we're hoping with this survey to explore the experience, the lived experience of people with neurological conditions in the UK and in the Republic of Ireland, and also those who are caring for someone with a neurological condition. And obviously the ultimate goal is to inform future advocacy, thinking about influencing and service improvement for these people as well. So I'll quickly touch on the key themes of the survey for the adults and the carers survey before passing over to Cate, who can give a bit more of an overview of the nitty gritty of how we'll be supporting dissemination with you all. But the themes for this year are firstly, learning about the person or the person who is being cared for, which is including key demographic information, but also a bit more about their condition and how it affects their life. Then we have some wider sort of life and overall impact areas. We want to understand, areas such as mental health, physical health, like well-being, how they feel about their current life, which includes things much more outside of health and slightly more holistically in terms of the lens we're taking. So thinking about the financial aspects, the social aspects, and how people feel about how they're coping. And so for carers as well, this focuses both on their experience as a carer, but also getting the information about the person they're caring for as well. And then obviously in terms of service improvement, we want to be able to explore in as much detail as possible the experiences of touch points that people have with the healthcare services and social care services, whether that's specialist, non-specialist. And this is thinking really broadly in terms of, how do they feel about interactions they've had? How do they feel about the information they're getting? How do they feel about their future or treatment options? So yeah, the survey obviously can be used for service improvement at a national level. But our goal is to be able to give this sort of breakdown at a regional level, but also at a charity level for people who are able to disseminate for us, and condition level as well. And all of this is great and it's really exciting, and there's so much potential with this survey. But obviously being able to get it in front of the people who we want to fill it in is a key thing, and that's where we're hoping you'll all come in. So I'm just going to pass on to Cate now to give a bit more of an overview about what we're hoping that looks like.
Morning, everyone. I hope you're doing well, having a nice morning. Thanks again, for having us. And just to build on what Hannah was saying, and what Georgina was saying as well. So obviously with the survey, we want to reach as many people as possible and get as many people as possible to fill it in, because that will make the quality of the data and the storytelling so much richer. And so we're aiming for 12,000 responses, which we're really excited about. This should be the largest number of responses yet for this survey. And we need and really appreciate your help with helping us to reach this goal. And with this in mind, we want to make it as easy as possible for you guys. So we're offering a few bits of support to kind of help with that. But it might be useful, first of all, just to quickly recap the different ways that people can fill in the survey. So simply, it's just online, which will either be through a QR code or a link. And that link will actually be linked to your services, so that we'll be able to provide data linked to the people who use your services, which is really interesting. And then the two other ways are via telephone. So if it's more accessible or comfortable for people, they can ring us up and do the survey with us over the phone. And lastly, paper versions, which will be available for people in the clinics that they go to. And so the key two routes that you can use to promote the survey are online, by email, text, and social media, as well as you may have an idea if it would be possible to promote the survey through your face-to-face services as well, which would be great as well. And so in terms of what we can help you with and send you, so we are happy to send you a drafted comms pack, which is written in an inclusive way with all the relevant information that you'll need. So that will include a bit of background to the survey, as well as people's options for filling it in. And yeah, you can of course tweak it as well according to the tone that works for you, and adding your brand and things like that. That pack will also include a poster, as well as that link and QR code that I mentioned, which will be able to link any people's responses to your services, which is really interesting. And we're excited as well, we'll be able to give you monthly updates on the response rates from people that use your services to kind of keep track of how it's going, see who's responding. Yeah, so essentially. So it would be great on the next slide also just to chat through sort of some ideas of top tips for dissemination. So these are just kind of like some initial ideas, but they're definitely not like a definitive guide. And of course, like as you guys start sharing the survey yourselves, you'll probably figure out ways that seem to work best and are more effective. And actually, it'd be really great to hear from you guys about what is working. But some starter ideas is that from the last iteration of survey dissemination, we found that direct email and text can be more impactful, encouraging responses. And yeah, that's useful to know. Other than that, just obviously it'd be great if your team is feeling confident about the different dissemination routes and having those conversations to keep everyone excited about disseminating the survey and what we can get out of it. And the other really significant point is that obviously with this iteration of the survey, we really want to make sure that the sample of people who respond is as diverse as possible, raising the voices of as many people as possible in different circumstances and from different backgrounds. So just love you to keep in mind that about that, and if there's any way you can be a bit more targeted in trying to encourage that diversity of responses. And our monthly updates will give a kind of a breakdown of those different types of diversity, so that will help with like understanding any gaps that we have at the moment. But yeah, so kind of thinking about next steps on the, yeah, so it's useful to just, yeah, please, it'll be useful if you guys have a think about which sort of routes will work for you in terms of dissemination. We'll also provide some written comms after this just to clarify what we'll be giving you. And one thing that might be useful to think about is getting the space for survey promotion in your comms calendar as well. So that's the 22nd of July. We can follow that up in writing just so it's clear. Yeah, let us know how you intend to use the survey at the email written there. Really excited to be working with you guys.
Great, thank you, Kate. Before we discuss outputs and open it up to Q&A, I just Rob Music from the Migraine Trust has kindly agreed to give us a few minutes on how he's and the Migraine Trust have used the survey results in some of their work to help perhaps inspire you to think about the same. So Rob, can I pass over to you, please?
Sure. Hi, good morning, everyone. I haven't got any slides, so I'm just going to talk. So the Migraine Trust is the UK's lead organisation in terms of supporting people living with migraine. Our work covers support, information, research, and policy health influence. And actually, the data from the survey covers every bit of work we do. In terms of numbers, 10 million people are affected by migraine. There's around about 1 million people who live with chronic migraine, and there are significant challenges around awareness, both with public and healthcare professionals, around the diagnosis, the care pathway, access to exciting new life-changing treatments, and lots of challenges around myths and stigmas around migraine that need to be broken down. And so, like all of us here, data and evidence is key to improving our story and trying to get better impact and outcomes for I guess the people that we're all advocating for. And in terms of the data from last time, the migraine data, when compared to other neurological conditions, quite often it was more compelling. Some of the data it was worse. A number of different areas. So some of the examples were the journey generally, but seemed to be much worse in terms of that care pathway treatment, impacts on quality of life data, being able to undertake day-to-day activities, feeling of being involved in decisions with healthcare professionals, mental health and well-being. All of these were worse compared to many of the overall data that was sent to us. Things like specialist nurse appointments, worse. We know that's a real challenge in terms of migraine, where the FTE numbers per 100,000 is significantly worse But of course, we know there's a major neurological workforce challenge as well that we're all calling for as part of the 1 in 6 campaign. Information about the condition was worse in terms of what was being shared by healthcare professionals, and in terms of that health and care piece being joined up again was worse. And they're just some examples. So for us, it was really valuable, rich data to add on top of the data that we also get from our own community in terms of just the various pieces of research and surveys that we run with them. And I think I touched on earlier on, so I think for us, the data was really valuable in lots of different ways. Raising money, so with fundraising applications, some of the data was quite different from some of our own. It backed up our own story. It was new data, new evidence, really powerful. I think for funders, it was helpful to see that contrast in terms of the impact of migraine against other neurological conditions. We've used it a lot around our work around health and policy influence, one-to-one meetings with parliamentarians. We've run events at all the main parliaments over the last year, including a roundtable in Northern Ireland, because it was just before the government was restored. We used data there, again, really useful at that level. In terms of healthcare professionals, a range of meetings. I've spoken at a couple recently, one a couple of weekends ago with 120 key people there. And again, really valuable in terms of enhancing the challenge around the current impact of migraine and the opportunity for all of us to turn that around and be heartful and create change based on the data that's there. I've used it at roundtable meetings, such as with potential work with ICSs and a sort of in-person meetings with funders as well. So for us, the data's been really valuable, really useful in lots of different situations. Really grateful to Georgina, to Sam, and the rest of the neurological team for the gift of looking at the data overall and providing a range of different comparisons. That was very, very helpful because there is so much data there. It feels like there's a real wealth of data. And I think the fact that we're using data from research that is, the survey is high numbers, it's really well respected, it's got a great reputation, the work by all the different alliances, that for us, that added the credibility in terms of when we were putting that data forth in terms of the different pieces of work we do, and it shows it wasn't just fluff. So for us, yeah, it was really helpful. Really looking forward to seeing what comes out of the next survey. Again, we'll absolutely use it again as many ways that we can do. So just thanks again to Georgina and Sam, the rest of the team. And I hope that was sort of helpful, brief overview of how we've used it.
Perfect. Thank you, Rob. Really appreciate that. And then before we open up to Q&A, just a note on timings at the other end. So we are aiming to provide you with a cut of the data for the condition that you're interested in, or conditions that you're interested in, as I mentioned, by the end of March. We also, as I mentioned, we're going to be developing a range of outputs depending on the results and what they tell us, so that'll obviously inform what comes out of it. But we're looking towards April 2025 to make that public. Our ask is that we don't kind of breach that embargo, essentially, so we're able to go with the wider results first, if that's okay. But what we'll also do is provide support to you to kind of cite the data, interpret it, and happy to discuss it in a bit more detail when we share it with you. And that'll come in the form of a templated report, as Kate's already mentioned. So that is coming your way. So I'll now open it up to Q&A. I can see there's a couple of comments that have already come through in the chat, which is great. The first question I spotted was from Mike, who's asked how the results will be presented in the Republic of Ireland. And I'm really pleased to say that we have Mags, who leads the Neurological Alliance of Ireland, on the call. So Mags, do you want to come in and introduce yourself, please?
Hi everyone, Mags Rogers here from the Neurological Alliance of Ireland. Delighted to be part of this project for the first time, and delighted to be at this call this morning hearing all about it. We're a relatively small alliance in the Republic of Ireland. I suppose small in terms of staff, team, large enough, I suppose, in terms of representation. We've over 30 neurological charities that are members of the Neurological Alliance here in the Republic. We're in a very similar situation to yourselves in the UK advocacy-wise. We're finding a lot of similarities when we've been working with Georgina and her team, and also with Revealing Reality on the survey design. We find a lot of commonalities in terms of the issues people with neurological conditions experience. So as I say, this is really timely for us. It's coming at a really good time in terms of our advocacy programme, and we're really looking forward to using the data and the information from the survey. And I love Rob's honesty that this survey is not fluff by any means. It's a really useful data, as I say, to inform so many aspects of the work we do, in particular our advocacy programme. So delighted to be involved. Just coming back to Mike's question in terms of how this will be disseminated here in Ireland and influence members. I suppose we have good, well-established relationships with our political community here in Ireland. We're probably facing into a general election, depending on who you listen to. We're looking at probably this autumn. So we'll have a new government, a new administration settling in around the time that the survey results come out. So we have a plan. We have, as I say, we have an ongoing programme of communication. We have an annual work plan of communication with elected representatives. So this will very much slot into that. And as I say, we're getting our politicians new and fresh through the latter half of the year into 2025 to present the results of this survey to them. So delighted to be involved. Thank you. Thanks, Georgina.
Brilliant. Thanks for coming in, Mags. Appreciate it. I'm also pleased to say that Paul, who's a member of one of our action groups, has joined us, and I asked him to perhaps just give a couple of minutes on why he's getting involved in the survey. So, Paul, can I hand over to you to just give us a flavour of why you're getting involved, please? Thank you.
Yes. I'm a paid ambassador from Genius Within, and that allows me to get involved in different projects that are going forward, and especially with the survey with the Neuro Alliance. I've got Tourette syndrome, so if you notice my tics, just bear with me, thank you. Yeah, and the reason why I want to get involved is because I feel in the past that I've not had a voice, and you know, with the crisis that's going on with the NHS, you know, things seem to slow down and you don't seem to be getting anywhere. And I just think that this gives me an opportunity to have my voice heard. And I would strongly encourage everybody else to get involved with this survey. Hey, thank you very much. Sorry about the tics. I'm just a bit too ticky this morning. Hey.
Fantastic, Paul. That's really great, and thanks for joining us this morning. Appreciate it. So that gives you a flavour of where we are and the approach that's being taken to develop and disseminate and report on the survey. As I mentioned, there's plenty of information that will be coming your way in the form of communication and engagement packs and social media assets and so on to help you with promotion. And hopefully you can now start thinking about how you might want to use the data as well. Does anybody have any questions or comments? Mike, do you want to come in?
Yeah, thanks very much. My question really is, given that at the moment, apparently there's an NHS transformation going on and trials in neurology are happening around, based in St George's Hospital in Tooting, South East England, and also Walton Hospital on Merseyside. So the people there will probably give a better response than the people in the rest of the country. Will the survey take into account the fact that these people ought to be able to benefit more, or will they, or maybe services they need maybe become more apparent?
Yeah, thank you, Mike. So I'm really pleased to say that in terms of services, we've got, I think it's around 17 services that have already signed up, including George's and the Walton. They were two of the first clinics to sign up. So we've got but what we're finding is that a good range of clinics actually are being involved. So we're going to have good representation as well from those areas that aren't neuroscience centres like St George's and the Walton. So that we're hoping that will allow us to provide some comparison. The other thing we're aiming for is to, I think as Cate alluded to, is to break the data down in England at least by integrated care system level, because obviously lots of different decisions about how services are funded, I think, as you're alluding to, are being made at an ICS level. And of course, we've got a really good insight collectively as to where services are, the referral routes in, and likely barriers to those. And so that comparison will allow us to delve into that a little bit more deeply. And if there's glaring kind of variation, then for example, between St George's and areas that aren't undergoing transformation, that would be a pretty good indicator of what's going right, or indeed what might need to change. The other point I was just going to mention is that we have actually already had really good support both from the NHS England Neurology Transformation Programme to promote the survey this time. So they're going to be doing things like promoting it through their internal NHS England channels, which is really good. And they have a dedicated service webinar that's going to be promoted through. And the National Clinical Director, Niran Nimalanthan, who's very obviously linked into the St George's work particularly, is a big supporter as well. So so we're in a good position, I think, to roll out and try and assess some of those differences that we might find. Thanks, Mike.
Thank you.
Any other comments or reflections, either in the chat, or feel free to put your hand up. Thank you, Crippen, for your comment. The more we complete it, the more we share it, and more powerful the data is. Absolutely. Thank you. Great. No, that's fine. If there's no further questions, hopefully that's clear for the moment. So as I said, there'll be lots more information coming out over the coming weeks. The key takeaway, though, really is from the 22nd of July, please do carve out time to promote the survey to your networks. And if you have got any ideas already as to how you might be doing that, please feel free to get in touch via the info inbox at the Alliance. So, Paul, please come in.
Yeah, I mean, I think we've really got to sell this to our audience because everybody wants to know what's in it for me. And as I said, my personal experience is that I didn't feel I had a voice. And you get invited to do these things, and you think, well, I've not been listened to at my GPs, I've not been listened to at the hospital. Why am I going to be listened to here? So I think what we need to do is to our clients, our customers, hey, is really sell this point that your voice matters, your opinion matters. So please come forward.
Very, very well put. Thank you, Paul. And that point, I think, about feedback loops, so people know what's happening when people do share their experiences. So at the other end, is going to be absolutely critical, because we're aware that lots of people are asked to fill out surveys in lots of different parts of their life, particularly in healthcare. So really making sure that communication back to people is important, and people will have the option to share contact details with us. Andy, I've just spotted your question about being available in different languages. Yes, not least for Welsh, because that is a kind of legal requirement. But we will make it available in different languages. We're just working through the details of how best to make that happen. We had a telephone line last time, but the pickup wasn't great. So we're just exploring all methods around that. Yes, thank you. Crippen, you've got your hand up.
Yeah, it's just more of a general thought I just had in terms of actually the people on this group by dint of being here today, possibly be pushing an open door here with the people here in terms of sharing the survey and promoting the survey. So is there a plan to maybe get it out to people who are not here today, or try to encourage them a bit more? Because I think, as I say,
Yeah, absolutely. There are a few people that couldn't make it today. So first, we've got obviously a recording that will be available to all our members. So we'll disseminate that and be working with Neurological Alliance of Ireland, Scotland, and Northern Ireland, and Wales to do the same to their membership. So hopefully this is a good start to encourage people to get involved. And I have to say, obviously there's a lot of communications around the general election at the moment, but be prepared for a lot of communications from us about this survey in particular to encourage you to take part. So there'll be plenty that we'll be doing certainly to engage members that aren't here today. The final point, I guess just to mention, is obviously there's lots of people that wouldn't necessarily be an Alliance member that may well have an interest in this too. So we're also reaching out to other charities, perhaps with less of an interest in neurological conditions, but more of an interest in, say, health inequity, or with specific kind of community-led groups to try and improve that diversity, but also just try and ensure we've got the reach kind of outside of our expanding Alliance network. So yes, plenty of plans afoot, but please do share as much as you can with colleagues inside and outside your organisation. So thank you, Crippen, for raising that. Any final questions or comments? Lovely. Well, that's great. Thank you, everybody. So, as I say, there will be a recording of this, so please do feel free to share it with your colleagues internally. And a big thank you for turning up this morning. Really appreciate it, and speak to you all soon. Thank you.